All right, hello mighty family. Welcome back to another Dr. Eric Debunks. So many of my patients come to me with questions about supplements, particularly in the form of vitamins and minerals. I love that because it shows my patients are thinking about their health and are trying to become as healthy as possible. As doctors though, oftentimes we may feel uncomfortable recommending supplements, either due to fear of adverse effects or possibly even due to the lack of knowledge of them. I myself have always been in favor of getting vitamins and minerals we need in the form of healthy whole foods. However, I realize that when it comes to supplements, it's also important to personalize it to each of our patients. So part one of this multi-part series of vitamins is going to debunk the general purpose of specific vitamins, their sources in food, as well as their adverse effects. The following series will dive a little deeper into certain clinical scenarios where supplementation can be beneficial and warranted. So let us begin and start with some background. So more than half of the adult US population uses dietary supplements, primarily in the form of multivitamins with or without minerals. So if you're taking supplements, you're certainly not alone. The bigger goal is making sure it is safe and right for you. So first, we're gonna break down vitamins into two categories, water-soluble and fat-soluble. This matters because water-soluble vitamins can be excreted in urine, preventing dangerous levels to accumulate in your body. So let us run through our water-soluble vitamins. So B1, also known as thiamine, is essential for carbohydrate and fatty acid metabolism. Chronic deficiency can lead to a rare disease called beriberi, which results in cardiovascular or nervous system involvement, such as heart failure or loss of sensation in your limbs, just to name a few. In developed countries, this disease is seen in people with severe alcohol use. Adverse effects from overdose include irritability, insomnia, elevated heart rate, and generalized weakness. Some food sources that contain thiamine include yogurt, fish, and lentils. B2, also known as riboflavin, is also essential for carbohydrate and lipid metabolism. It's commonly promoted for migraines or eye health. Deficiency can result in skin irritation such as dermatitis or inflammation of the mouth or tongue. High doses do appear to be free of adverse effects, apart from the occasional abdominal pain or diarrhea. Food sources that contain riboflavin include leafy green vegetables, dairy, and meats. B3, also known as niacin. This has a broader effect as it plays a role in many chemical reactions with our bodies. It's commonly promoted for lowering cholesterol and improving circulation. Deficiencies causes the 4 Ds of a disease called pellagra, which include dermatitis, diarrhea, dementia, and even death. Adverse reactions include flushing, nausea, and high doses can even cause liver toxicity. Food sources that contain niacin include nuts, seeds, legumes, brown rice, and various meats. B5, also known as pantothenic acid, it's involved in the metabolism of fatty acids, cholesterol, steroids, and the chemical reactions of proteins. Experimentally induced deficiency causes depression, muscle cramping, gait instability, and the burning of the feet. There are no known adverse effects, but really no indication for its use either. Food sources that contain B5 include eggs, mushrooms, and avocados. All right, team, I know this is a lot of information, but we just have a few more to go, so stay with me, okay? All right, B6, also known as pyridoxine. Its active form is a cofactor, particularly for amino acid metabolism and really many other metabolism and reactions. Commonly promoted for preventing vascular disease, improving brain function, and deficiency can cause depression, irritability, and possibly convulsions and even coma. It's indicated for specific scenarios such as sideroblastic anemia or a condition called homocystinuria, and even prevention of a tuberculosis medication called isoniazid-induced peripheral neuropathy. Adverse effects may include a higher risk of lung cancer, particularly in smokers. Food sources that contain B6 include bananas, salmon, and chickpeas. All right, B7, also known as biotin. It is important in the production of lipids, steroids, and the breakdown of amino acids. Commonly promoted for skin and nail health, cognitive health, and even balancing blood sugar. It is produced by the bacteria in our gut, so chances of deficiency is really low. No major adverse reactions, but it is found that higher doses may alter thyroid function tests. So for those that have thyroid issues, this is important to keep in mind. Food sources that contain niacin include red meat, legumes, brown rice. B9, also known as folate. This is a vitamin I think most people are familiar with. It plays a role in the metabolism of nucleic and amino acids. Deficiency results in macrocytic anemia. Deficiency, specifically in pregnant women, can lead to birth defects. And in those with genetic risks, excess folate supplementation may contribute to a higher risk of colon cancer. Food sources that contain folate include your dark leafy vegetables, peanuts, and seafood. All right, B12, also known as cobalamin, essential for red blood cell production and the maintenance of our central nervous system. Deficiency can result in anemia and issues with the spinal cord. Large doses used for non-clinical reasons are reported to cause nausea, vomiting, hypertension, a slower heart rate, and even anaphylaxis. Food sources that contain B12 include salmon, eggs, spinach. And lastly, vitamin C, also known as ascorbic acid, has many functions, including the synthesis of collagen, some neurotransmitters, and the production of steroids. Commonly promoted to boost immune system, lower hypertension, and promote wound healing. Deficiency leads to scurvy, a disease quite rare in developed countries, but consists of symptoms of bleeding gums, poor wound healing, and defective bone development. Adverse effects of such high doses of vitamin C include stomach discomfort, kidney stones, and diarrhea. Food sources that contain vitamin C include citrus fruits, bell peppers, potatoes. Whew! All right, Mighty Family, I know we have just gone through a ton of information regarding water-soluble vitamins. So let me see if I can break this down into a few mighty take-home messages. So 1, in a generally healthy community population, it is extremely rare to be deficient in these water-soluble vitamins. As you can see, they are all found in foods we commonly eat, therefore supplementation is rarely necessary. 2, there are many things these vitamins are heavily promoted for to favor sales. However, supplementation is really only necessary if there is a clinical need, such as preparing for pregnancy with folate, or treating anemia that is due to B12 or folate deficiency, just to name a few. 3, too much supplementation can lead to adverse effects, so they are not 100% harmless. Therefore, I do recommend checking with your doctors first prior to starting a supplement, because what may be right for one person may not be right for another. I hope this part 1 series of vitamins and supplements has been insightful. Let us continue to provide all the vitamins our body needs through giving it the healthy food it deserves. So stay tuned for the next part of the series as we dive into our fat-soluble vitamins. As always, I look forward to connecting with you all again soon. For those that are not a part of the Mighty family just yet, check us out at mightyhealth.com for more. We're striving every day to be the modern, holistic home for healthy living.